Hello, everyone, and welcome back to those who have been with us from the very beginning, and to our newest attendees, welcome. It is a pleasure to have you joining us for our full-day Aging with Purpose event. This is Jillian, CEO of Jewish Workshops, and I'm excited to get started with our next session, led by Doron Lazarus. It is such an honor to be hosting Doron Lazarus today. Doron is a certified sleep science coach, hypnotherapist, and the founder and chief sleep coach at Sleep Coach Academy. Doron has dedicated his life to help coach clients around the world. As a sufferer of insomnia himself, he knows how frustrating not being able to sleep can be. So combining his BSs from UCLA in psychobiology with years of research in mindfulness and sleep studies, Doron has pioneered the slumber solution to help clients around the world get the help they need. He is also the author of the groundbreaking work called Don't Mind If I Do, using the power of Jewish mindfulness to transform your life. We are honored to have you here with us today, Doron. Welcome. How are you?
Welcome.
Thank you. Wonderful. It's so great to have you here. I'm going to go ahead and pass the microphone over to you.
Okay, amazing. I will just begin. We'll get things started, and it seems like we got the thumbs up. So let's go ahead and dive right in. I'd like to thank Jewish Workshops for hosting me today. It's a very special event that's really to discuss a very pertinent issue, and I know they put out in the marketing material. This is not something that is discussed often, but it does affect everybody. So I think it's incredibly valuable that they're spending time, energy, and focus to be able to really give this the attention that it needs. I'm just going to move a couple things around here so I can see my own screen, and we'll go ahead and dive right in. Okay, we're going to be discussing a lot of topics today, but please, this is not meant to be medical information. It's for educational purposes only. It's not intended to give, it's not medical advice and not intended to diagnose, treat, or prevent any disease, disorder, or medical condition. It should never replace medical care given to you by your doctor or other health care provider. So we'll just put that as a disclaimer before we dive in and discuss everything health related. So allow me to introduce myself. I live in Cincinnati, Ohio now. I'm originally from San Diego, California. I went to UCLA and studied psychobiology. The human mind, the brain, the body, health was always very interesting to me. I ended up going to yeshiva for a number of years after college and ended up becoming a rabbi. I was working in outreach for 7 years in St. Louis and Chicago. And when that kind of road came to an end, I was thinking, okay, what am I going to do with myself now? What's my next port in life? Somewhere along that process, I had actually struggled with my own insomnia, and that was a very challenging period in my own life. I went to a lot of doctors and therapists looking for solutions and not finding them, and so I really started doing a lot of research within myself to be able to find a solution to my own sleep problem, which, Baruch Hashem, thank God I did, and I kind of had that in my back pocket. I helped others along the way, informally. And then in 2020, when I was looking to start my own business, I thought, what do I have a background in? What do I have a skill in? Sleep coaching. Let me get out there. Let's do this. And let's see what we can make of it. So over the last 3 years, I've been developing, that style of business, working with people with a variety of sleep issues. So in addition to becoming a sleep coach, I also subspecialize in hypnotherapy, functional nutrition, and a host of other modalities. And about a year ago, I actually created an academy to be able to help people become sleep coaches as well. So that's just me in a nutshell, and I hope to get to know all of you here today. We will throw some comic humor along the side, as I think it's important for people to, especially this time of the morning, to be able to appreciate that. Okay, I'm sorry, Tom, you don't have chronic fatigue syndrome if it only occurs when you're going to see your in-laws, right? Or maybe with this crowd, maybe you're going to see your son-in-law. Okay, but nonetheless, let's go ahead and dive in. So this is a basic outline. Obviously, we could speak for a while about sleep. There are so many topics and so many interrelated issues that come up, but I wanted to touch on 7 things, and certainly we're not going to give each one of them an exhaustive discussion, but to at least raise awareness and begin the discussion on 7 key factors that I feel affect sleep, especially amongst the aging population. So number 1 is the importance of sleep. Number 2, why sleep changes as you age. Number 3, addressing underlying anxiety. Number 4, all that apnea. Number 5, nighttime urination. Number 6, a real talk about sleeping pills. And number 7, GI and hormone rebalance. Okay, like that's a lot to cover in one session, but I figure we're going to be brave, we're going to be excited, we're going to go ahead and dive right in. Okay, so the importance of sleep. I believe that sleep is important at every age, certainly from babies to toddlers to teenagers, but I think it's perhaps underrated how important sleep is, especially in our golden years. So these are just a few points and call that sleep gives us. Increases longevity, creativity, reduces inflammation, increases emotional well-being, lowers stress, helps maintain a healthy weight, improves immunity, repairs damaged tissue and cells, reduces accidents and falls, and decreases risk of dementia. So imagine that there was a drug, you went to your doctor and he's like, yeah, we got this miracle drug. It's one pill and it does all of these things. I mean, this would just be the hottest drug on the market. Everyone would be standing, around the block at the pharmacy to get their hands on it. And lo and behold, this is the miracle drug of sleep, and it's free. Well, maybe free, but it is free for the taking if you know how to get it. And it has so many health effects that are especially important in the aging population, both in terms of the physical health as well as the mental health. And therefore, I think it's just worth people maybe starting to prioritize sleep that maybe they hadn't in the past. Maybe in the past they had a different perspective on sleep. They figure, their father told them, sleep's for the grave, or, wimp sleep, or, kind of push through it, or it's okay to be tired, or it's normal at your age to be tired. Well, I don't believe in any of those things. I believe sleep is a very top investment that has many, many health benefits, and be able to improve our life in so many ways. Okay, I had a hard time hibernating. My phone kept going off. This is why bears don't have smartphones. Okay, why sleep changes as you age. So if you take a look over here, these are 2 individuals, and we can see this is a sample sleep report. Our sleep is not static. It's not like we go to sleep and we kind of, submerge in our submarine and go down for 8 hours and then pop up at the end. Our sleep is going through cycles and waves every 90 minutes, from lighter sleep to deeper sleep to REM sleep, rapid eye movement. And you can see over here in the younger adults, there's kind of more, first of all, they go deeper in these stages of sleep. And maybe let's say there's 4 or 5 cycles throughout the night, and then they're waking up. But as we get older, you can really notice a few things. Number 1, you can notice that the depth is more shallow. They're not going as deep as they used to, and it's more fractured. They're coming in and out of these wake cycles more frequently throughout the night. And so I think the first important call is, as opposed to like, oh my gosh, like that's alarming, like look at that, that's not a good sleep cycle, is to embrace the fact that in every period of life, your sleep changes. Just like, babies don't sleep like toddlers, don't sleep like teenagers, people don't sleep in their 20s, and as people get older, their sleep naturally changes. Embrace this reality. Don't be scared that this, so to say, is the reality as people get older, and learn to thrive with your new sleep cycle, right? So just to put over here, we have decreased nocturnal sleep time in general. People need less sleep, delayed onset of sleep, a little bit harder to fall asleep, advanced circadian rhythm phase, early to bed, early to rise, reduce slow wave sleep, reduce rapid eye movement sleep, reduce threshold for arousal from sleep. That means they're sleeping lighter, fragmented sleep with multiple arousals, and daytime napping. This is the reality. Your brain is changing, your brain is developing, and this is something that is just a part and parcel of life. And so many people, especially when I'm working with clients, are like, oh, this is alarming. I need to go back to sleeping 9 or 10 hours. Well, I did when I was a teenager, and you think that's funny. You think that's like humorous. Why would anybody try to sleep the way that they did when they were a teenager? Well, lo and behold, I had one of my coaches, I trained coaches that they were discussing. They have a client in New York who said, oh, I need to sleep 10 hours because that's how much I did when I was a teenager. People are holding on to those false beliefs about their sleep. And I really encourage, especially the aging population, to embrace this. As opposed to running away from this, be like, oh, great, I need less sleep. I'm going to make my morning hours productive. I'm going to get up. I'm going to do all those things early in the morning. The morning is a glorious time. And if you have that opportunity, don't fight against your sleep cycle. I find the number one, so to say, challenge I see with clients that get into bad sleeping patterns is they're really fighting against their sleeping cycle. What their body, so to say, is telling them naturally they want to do, they're trying to fight against their own nature, and then they create conflict, and then they create stress, and then they create anxiety, and we're going to speak about all those things today. But to really embrace this, and you know what, if this is your new reality, then embrace it, but get excited. This is part of aging, this is part of life, and if you need a nap during the day and you now have the flexibility, maybe you're retired or semi-retired, and you have your flexibility in your schedule to be able to do so, then go for it. You know, I believe that there's not one chronotype. There's not one, oh, every individual needs 8 hours of sleep a night, and if you don't, terrible things are going to happen. I think that's a farce that perhaps the media gives off oversimplified picture of our sleep, and each individual is different. We all have natural sleep personalities. Those personalities change as we get older, and so to understand this, embrace this, and you know, do your best to optimize it, which we're going to speak about right now. Okay, addressing underlying anxiety. I think, as opposed to viewing it like, okay, you know, I have this sleep issue, and you know, I can't believe I'm not sleeping well, or can't believe I'm tired all the time. I want you to think about this stage in your life as saying, you know what, maybe there are underlying issues that I've kind of buried, or I've suppressed, or I've never really dealt with, or I've kind of pushed through for the first few decades of my life. And as opposed to viewing sleep as like, I desperately have to fix it, there's something wrong and I have to treat the symptoms. If you are experiencing anxieties, phobias, stress, or trauma, which is very common in our generation, and maybe you've never addressed these things in your entire life, I want you to think of this as an opportunity to say, you know what, if my mental health is not that great, if I find myself dealing with a lot of negative thinking, a lot of racing thoughts, a lot of anxious feelings, maybe even panic attacks, nightmares, all these kind of things, view sleep as the window into your own mind. View sleep as the opportunity to say, you know what, if I'm not sleeping well, this is really just a perspective that I get to have into my own mental health. And if I'm not sleeping well, this is my golden opportunity to take an honest look at my mental health and ask myself, what emotions am I holding on to? What fears am I holding on to? And now that I have the time, the energy, and the focus to really invest in myself, how can I deal with this in a comprehensive way? Because I do not believe that people need to struggle secretly with their mental health, having affecting their sleep, and carrying with them all that negativity and all that burden that they're holding on to. I do believe that there are powerful modalities to be able to get to the root of this issue. Meaning, as opposed to treating the symptom of sleep, think about where the sleep issue could be coming from and how I can use this as an opportunity to be able to affect that. Nightmares themselves are an interesting example. Many people desperately want nightmares or vivid dreams to go away without stopping to think, you know what, maybe this is my mind trying to tell me something. In fact, there was a very interesting book called Waking Up to Your Dreams, where the author really described how the dreams are really a window to the subconscious mind themselves. And when you learn to hear your dreams, you actually get in touch with your greatest and highest mission in life. So I think these are just all perspectives to have, but definitely addressing the underlying issues of anxiety is something that is very important. Okay. How well I sleep at work, watching a movie, driving, and then laying in my bed at night. If this sounds like you, we definitely have some work to do. Okay, let's go ahead and let's speak about sleep breathing, because this is a very big issue. And I think if I would say there was one kind of underappreciated or underrated sleep issue, it's sleep breathing. And when I say sleep breathing, I mean snoring and apnea, just to basically describe the difference. So snoring is where we have a narrowed airway. There's friction somewhere in our breathing mechanism as we sleep. So either as the air goes in or as the air goes out, we're putting friction in those airways, and that's creating that loud sound. You or your spouse might be familiar with it, and it can be very significant. It's oftentimes more for the spouse. I know there are many couples who have chosen to sleep in separate bedrooms because of this very pronounced snoring, and therefore snoring can be a very significant issue. And more importantly is apnea. Apnea, where is actually not just the friction of the airways, but apnea is actually where there's a complete breakdown of the breathing process. There are two types of apnea. There is central apnea, which is actually an issue of the nervous system, where the brain kind of forgets to breathe at night. It's a very serious issue, as well as obstructive sleep apnea, where there's something physically obstructing. Usually the soft tissue palate is falling on itself. As people get older, it's very common that their apnea will become exacerbated. Risk factors for apnea: if you're a man, if you're over 55 years old, if you have a large neck size, if you're obese, if you know that you snore, if you know you wake up gasping for air, and if you're chronically exhausted the next day or feel like you're waking up frequently throughout the night, I would highly suspect if you only have one of those risk factors, you are at high risk for apnea, and I would definitely get checked out. It's important to know what your options are, because it can happen. So what happens for a person, let's say you have that soft tissue palate that's falling back on the throat. So this can happen 20, 30, 40, even 50 times an hour, where the body will basically be strangulating itself. So the body can't breathe. The blood becomes deoxygenated. The body realizes that it's going to a very dangerous state. It shoots adrenaline to take you out of the state. So you wake up, you can even do this subconsciously. You take that gasp of air and then you fall back asleep. And this can happen repeatedly throughout the night. You can imagine the stress that puts on your body, both in terms of breaking up your sleep cycle and in terms of so many other issues, both mental health as well as physical health, heart disease, diabetes. Many very serious health risks have been linked to apnea. So it's very important, if you do suspect anybody who has apnea, and sometimes it doesn't have to happen in the older, overweight man. I've seen young, thin ladies as well who have apnea, but you definitely want to get that checked out. That is something that is usually discussed in a sleep test, whether it's an in-clinic sleep test or at a home sleep test. We have devices we use to screen our clients, who potentially have apnea, but it's something that you definitely want to get examined. Over 80% of people who have apnea on the planet don't know it. They go undiagnosed. They think that they're tired all the time, or I think just have terrible sleep quality. But apnea is that secret culprit and killer, and so you definitely want to get checked out and understand your options. So understand what some of the basic options look like. So the traditional treatment for apnea is called a CPAP machine. It stands for continuous positive air pressure machine. And this is a device you wear either over your nose or over both your nose and your mouth. And it basically senses when you stop breathing, and it forces the air into your airways and keeps those airways moving. You have new machines that are now increasing with comfort, increasing with automation. You have the BiPAP machine, which is actually the bilateral breathing both in and out. All of these are options. Now, while the CPAP machine is great in terms of its efficacy, and it works quickly, the challenge is a fewfold. Number one, they are back ordered now. I know Philips DreamWorks had a recall on one of their items, and that's caused a little bit of backlog. But more importantly, over 50% of people who desperately need a CPAP machine because they have significant sleep apnea within 6 months are not compliant of their machine. And if that's you or your spouse, then definitely pay attention now, because it's very normal that people will either hate their CPAP machine, can't sleep with their CPAP machine, just give up on doing it. And if that's the case, you definitely want to either explore ways that you could make your CPAP machine more comfortable, more usable. Maybe you need to speak to a tech, maybe you need a new CPAP machine or a new mask, or to be able to look into other options. And I'll describe what some of the other options right now. There's something called the MAD dental device. It's called the mandibular advancement device. It's a device, looks like a retainer that you wear at night, and it sets your jaw a little bit forward. There are special dentists that the part of their practice is they build these devices. But make sure you get the counter device, because what happens is the device at night sets your jaw forward, and you don't want now jaw issues. So what a good dentist will do is he'll create you, so to say, a countersink where you will wear in the morning something to push your jaw back to be able to keep your natural jaw and dental alignment. The MAD dental devices do work about maybe 60 to 70% of the time, but they can be very effective. I have seen them be very effective for clients. And if the CPAP machine is not working for you, then the mandibular advancement device can be helpful. There's something called the Inspire device, which is actually, I know many people might get weirded out by it, but it can work for some people, where it's a surgical device that they install. There's a chip that gets installed in your chest, and then there's a wire from that actually goes to the back of your tongue, and it senses when your blood oxygen starts dropping, and it sends a electrical impulse. You can't really feel it, but a mild electrical impulse to your tongue that causes the tongue to actually move forward and to open up those airways, and you can actually turn the thing on with a remote control with your device, and that could be an option if that's what you're into. Also, to get checked out by an ENT. Maybe there's something basically anatomically off that's blocking those airways, and surgery could help. You definitely, whatever your decision is, you definitely want to know your options, and you definitely want to know that you have apnea. Simply to ignore it because you don't like what the traditional options are is not a good option entirely. What we've developed in our practice are natural solutions for people that are not interested in necessarily surgery or devices, or maybe have tried these with, they're not able to sleep with a CPAP, or these were not effective, or they just don't, that's not their style of doing things. So we've actually developed a program that involves weight loss, breathing retraining, posture, tongue exercises, modifying food and drink intake. We actually had in our academy one of the world's leading experts on natural solutions to apnea. Her name's Tess Graham. She wrote a book and a number of papers and studies on the topic as well. Recommend checking that out. But like I said, whatever it is, don't sweep it under the rug. Don't ignore it. As you're getting older, this is the opportunity to really now focus on your sleep, focus on yourself, focus on your health, and making sure that you might have been able to push through or ignore these things in earlier years, but now is really a time to open your eyes and see how much sleep can offer you. Okay, these are a couple of reports. So, this is just like a basic pulse ox report that we run in our clinic. This is your blood oxygen throughout the night. This is your heart rate. And you can see the difference. This is a healthy 21-year-old male. This is a 66-year-old male with very significant sleep apnea. You can see, ideally you want your blood oxygen above. This is the 94% mark. And you can see his was almost 100% above that 94% mark. This is a perfect sleep score. This is someone, now it is normal that as you age, you're not going to have blood oxygen as high. So I would say, the fact that he's starting off already a little bit lower is normal, but, the fact that it's dipping, not only below 90, but, going even here below 80%, these are very significant hypoxias. Hypoxia is the lowering of the blood oxygen that you definitely want to get this screen for and want to be able to check this out, because this can cause all sorts of damage. You can see, his ODI 4%, which just means how often did he come 4% off of his average, was 37 times an hour, and that can be very, very significant. So definitely want to get these checked out. Okay, this is what happens when you go to a sleep lab, right? They hook you up with all sorts of machines, monitors, and they say, okay, now just sleep normally. Okay, so if anyone does go to a sleep lab, let me know how that goes. Okay, let's dive in. And again, I know these are like very exciting topics, but as you get older, these are the realities of life. Let's speak for a moment about nighttime urination. It is very normal that as you get older, you will, like I said, we saw that graph from the beginning, that your sleep cycle is inherently more fragmented, sleeping more lightly, up more throughout the night, and going to the bathroom more throughout the night. While that is normal, as you get older, to get up once or twice, you go to the bathroom, don't fight that. That's just part of your body's and the natural aging process. At the same time, I do think there's a lot that can be done, especially if you're waking up frequently throughout the night, especially if you're not able to go back to sleep. Then there is a lot of things to think about how to improve and optimize this area. First, port and call, which is, I think, just good advice in general. You want to get checked out by your doctor, especially for our male listeners. you want to get your prostate checked out. Pelvic floor exercises, I would say, especially for our female clients, especially, in addition to our male, can be very helpful to strengthen those muscles, strengthen that whole region. Speak to, there are specific physical therapists who specialize in pelvic floor exercises in this area that can be very helpful to reduce that pressure that people are feeling at night. And I think there are some other options to think about. Number one is the blood sugar connection. We know people who have diabetes and other blood sugar dysregulation have a higher frequency of nighttime urination. And they have some very interesting studies, people who are able to get their blood sugar fluctuation under control are actually able to help with the nighttime urination significantly. So again, I'm not giving one size fits all solutions, but start to think about your blood sugar, start thinking about, am I eating processed carbs? Am I eating sugar? Am I eating junk food that perhaps, like I said, you were able to get away with in your earlier years, but as you get older, your body, kind of tells on you, it doesn't lie anymore. And it's telling you that this is not the optimal fuel for our body. Speak to your healthcare professional about a healthy keto option, which essentially you're sending your body to a state of what's called ketosis, where you're burning, as opposed to burning carbs for your fuel source, you're actually burning fats, and fats burn a lot smoothly and a lot more stably, and they have less the dips and the peaks of insulin, and therefore they can actually really level out your blood sugar and increase and decrease nighttime urination, which is an interesting question. Another interesting question is the anxiety link. Many times people will actually develop anxiety in regards to their nighttime urination. So, they will be constantly checking and asking themselves and worried, I can't fall asleep if I have to use the bathroom just a little bit. So sometimes there's a mental health component over here. There are medications and supplements that can help alleviate some of these symptoms. Before you go on any medication or supplements, certainly speak to your doctor, but I would tell someone to look at the holistic options first. Sometimes the medication or supplements are needed, and you as the consumer can decide what's the best option for you, but certainly to look at some of the holistic options before you would go down taking more medicine and supplements, because as you get older, reality is you're going to need more prescription medication, you're going to need more supplements. So why increase that list unless you have to? Sometimes it can be a great tool, but I would definitely look at the holistic options first. And then just to think about your nighttime drinking as well as your salt intake during the day. If you are having a lot of salt during the day and drinking a lot at night, chances are you're going to be getting up to use the bathroom. Alcohol can also affect this. So to think about the food and the drinks that you're having and how you can perhaps limit the salt during the day, limit the nighttime drinking, certainly limit alcohol at night, and to be able to have that. I'll share a quick story. I remember my grandparents, my family is South African. My parents were born in South Africa. My parents emigrated to America in the early 1980s, and my grandparents came to visit us in San Diego, and my grandparents brought 2 bottles of Scotch whiskey in their hand luggage because they said, the case could get lost, and then we'd have another to drink when we get there. So, just to keep that in mind and to limit the alcohol at night. Okay, let's talk about sleeping pills. Sleeping pills are very common, very common. There are over 45 million Americans who need sleeping pills to sleep every night, and an additional other 70 million Americans that are using sleep supplements, melatonin amongst many others, to be able to sleep. Now, I'm not certainly going to tell you right or wrong about sleeping pills, but I do want to have this as an opportunity to have an honest discussion and say, when was the time you went on sleeping pills and why? Maybe you went on sleeping pills because of anxiety. Maybe you went on sleeping pills because of stress in your teens or 20s or 30s or 40s. And I will ask you just to kind of take an honest look at that and say, do you really need to be on the sleeping pills? Are the sleeping pills simply habitual because you've been taking them for the last few decades and therefore, you continue to take them without questioning? Or you want to kind of explore that now? Perhaps you have more headspace, you have more time to invest in your own health. Maybe you weren't dealing with the stressors that you were dealing with earlier in your career. We need to be on the sleeping pills? And take a hard look at that, because it is known that sleeping pills, there's a lot of studies that there are side effects and risk factors, both short-term, especially within the aging population, people getting up, hallucinating, falling, all sorts of things. I know Ambien specifically is linked with night eating, night walking, night driving. I remember I was speaking to a client in Los Angeles who told me about a friend of his who went to bed with Ambien at night, and he woke up in the LAPD drunk driving precinct in the prison because he had taken his Ambien. He went subconsciously into his rolls. It was a Bentley, actually. He went down Sunset Boulevard, crashed into 4 telephone poles until he totally totaled the car, and the police picked him up as a drunk driver. So, again, just putting it out there, I'm sure everyone can make that own decision, but there are side effects. There are links with health issues, cancer, dementia, Alzheimer's, all sorts of things. And so, again, I'm not trying to scare you. It's better to get sleep on a sleeping pill than no sleep at all. But to think about, do I really need the sleeping pills? And if not, if I'm just doing it because I've always been doing it, or doing the last 20 years, or I'm scared of getting off of them, is there a way to wean off of them effectively? This is something that I do specialize in our practice of getting to the root of the issue of whatever was causing the dependency on the sleeping pills to begin with, and slowly and naturally weaning off of them to allow yourself to have natural sleep, that has all those health benefits and none of the risks of sleeping pills. I remember one of my first clients was actually a 85-year-old lady in Jerusalem. She herself was a clinical psychologist who had been on sleeping pills for the last 20 years. And she kind of asked this question. She says, do I really need to be on it? And she felt, no, I really don't. And it was hard for her to get off it by herself. So we worked closely together, and with 6 weeks, she had dropped 20 years worth of sleeping pill use, done. And she was now sleeping naturally, and she did it at the age of 85. So I really believe whatever age you are, again, speak to your doctor. This is a collaborative decision, and I never criticize anyone's decision or anybody's use. I myself have been on sleeping pills. I know the ins and outs of how they work and the psychology and the chemical dependence and the psychological dependence and the whole thing. But to have an honest look now, just to really look that bottle in the eye, or your spouse in the eye, or your doctor in the eye, or whoever you want to speak about with this, and to be able to think, maybe now is the time to wean off sleeping pills. Maybe I really don't need them. Maybe I am ready to allow natural sleep to take over. Okay, this is a lady. I don't want to sleep like a baby. I just want to sleep like my husband. I definitely in my practice see a greater preponderance of insomnia and sleeping pills amongst my female clients, and greater snoring and apnea amongst my male clients. But we see both on both scales, and oftentimes one spouse is sleeping well, the other spouse is not. Okay, let us speak about holistic health, GI hormone rebalance. Because from my perspective, there's kind of 3 elements. There's 3 pillars that go into a great night's sleep. You have the mental health, you have physical health, and you have breathing. So we've discussed, the breathing element, the snoring and the apnea. We've discussed the mental health. Now let's get into the physical body of sleep. Because like we saw those charts that it is normal that as you get older, your sleep quality is going to become a little bit different, a little bit lighter than it was, but that doesn't mean that you have to throw your sleep quality out. And maybe, again, now is the time to think about, is my body overall healthy? Are my hormones overall balanced? And especially we see this amongst women who are going through premenopause, menopause, and postmenopause, a lot of sleep fluctuation that happens with that. And how can we ride that wave differently that it's not having such a all-encompassing effect on our sleep? In my perspective, GI and hormone rebalance starts with healthy eating, and that I believe is an individual decision, an individual also guidance of what that looks like. I'll tell you about a 26-year-old client of mine. She was a lady in New York who had terrible hormone fluctuations. She was otherwise healthy, but her hormones were all over the place. She was having crazy mood swings, suicidal ideations around menstruation, irregular periods, missing periods, heavy bleeding. Like, her hormones were really out of whack. She ended up working with an endocrinologist who's like, okay, we're just going to put you on birth control. That's just going to suppress your natural body hormones, and we're just going to artificially control them. And she did that for a few years. She was single. She didn't want to be on birth control. And she recognized that wasn't getting to the root of her problem, and it didn't really fully take care of her issues. So she was looking for a holistic situation, and we worked closely together on a lot of different issues to be able to, different factors to be able to help her. And the number one thing, she was completely recovered, went back to a normal cycle, no, crazy PMS symptoms. But the number one thing she found that helped her was the elimination of sugar, processed foods, and junk food. And I believe that. I believe that was so much when we're looking to be more healthy, mentally healthy, physically healthy, sleep well, starts with food. Before we jump to prescription medication, it's really worth cleaning up your diet. And look, we know what unhealthy foods are like, but in terms of, what exactly do I eat? I'm a big believer that we have different metabolisms, and we should get in touch with our individual metabolisms based upon our body size, based upon our personality, based upon our lifestyle and our age for what we need. Also, one of the things I actually run in my practice is called an MRT food map, a mediated response test. I got my notepad from my company over here. So the MRT food map actually tells you very specifically for you, for your blood and your body, what is inflammatory to your system and what is healthy to your system, so you can make an educated decision, not just following generic advice that other people are saying. There's a strong connection between our GI system and sleep itself for many reasons. Now, number one, if people are in gastrointestinal pain, discomfort, if there's bloating, diarrhea, cramping, gas at night, that's going to affect their sleep. But even beyond that, there's secondary connections where you can, let's say someone has a parasitic infection in their gut. When is the body fighting that? It's fighting it at night. So it'll actually shoot up an inflammatory response. They'll have a high level of cortisol to be able to quell that infection. And lo and behold, when your cortisol is triple what it should be, you're not going to be able to sleep right either. So to think about the connection, GI, sleep, overall health, it's all interrelated. Maimonides wrote this 1,000 years ago, that the root of physical health starts in digestion, it starts in the gut. And I think we're only starting to uncover how true that is. Fascinatingly, the neurotransmitters, the chemicals in your brain, especially dopamine and serotonin that are key to mood, sleep, chemical precursor to 5-HTP and melatonin, are made in the gut. They're not made in the brain. They're made in the gut and sent up to the brain. And when your gut is in a state of imbalance and dysbiosis, that can affect your mental health and your sleep as well. Sex hormone rebalance, again, it's obviously very normal that our sex hormones change as we get older, but to think of how, we don't want to crash land, how we can naturally balance them out. If you are interested in hormone replacement therapy, speak to your doctor, as that can be very powerful, but especially if you do have a risk of, things like breast cancer, ovarian cancer in your family, the doctor is obviously going to discuss those risks and find the best option. But even if it's not full-blown hormone replacement therapy, there are a lot of supplements that can help naturally rebalance the sex hormones, that you have them in a balanced state, as well as the cortisol, melatonin. Think about cortisol, melatonin as kind of the yin yang. Cortisol goes up, melatonin goes down. Melatonin goes up, cortisol goes down. And what we're starting to discover now is that melatonin is not just a sleep hormone. It's not just, this is going to put you to sleep, but melatonin is actually something that is a antioxidant and something that's very important for your overall balance and health here. Okay, let's go ahead. Give me 10 seconds. Okay, I will deal with that question in a second. Okay, so the quest for meaning is a key to mental health and human flourishing. I believe that it's important that as people are aging, that they find the meaning in what their life is, that they find things that they're passionate about, they find things that they can take advantage of, and they find meaning in whatever they do. Because, certainly I do not believe that retirement is a Jewish concept. I think that yes, we can change our life trajectory. Yes, we can do different things, but we have to always be busy. We have to find meaning. We have to find purpose, whether that's volunteer work, whether that's art, whether that's a hobby, but to be able to find your meaning in what you do throughout life. So I will we'll end here. I'll just share a couple of details if anyone wants to get in touch with me, and then I'm happy to take any questions. So if you are a high tech, you can join us on podcasts, on any of the podcast apps. I have 2 regular podcasts we update every week. One is specifically sleep related to mental health. It's called Sleeping Outside the Box. And the other one is actually called the Jewish Meditations. If anyone's interested on kind of the bridge between spirituality and mental health, I create live Jewish meditations every week, and those get updated. We just shared one on happiness yesterday, so you can check us out on your favorite podcast app, as well as if anyone wants to get in touch with me, this is my work cell phone. You can reach out to me, call me, text me, WhatsApp me, or you can visit us online at sleepcoachacademy.org or email me at doron@sleepcoachacademy.org. And I will share that if anyone is actually interested in becoming a sleep coach, I know that might think like crazy ass, but a lot of people that come and train in our program are actually around your age, that they're looking for something new. They had maybe their day job, maybe they're retired or semi-retired, and they're looking for something to keep them busy. They're looking for something to be passionate, to be able to help others. They want to stay active. They want to stay vibrant. They want to be part of a growing community of coaches that's all sharing and innovating and helping each other. So if either of those things, whether you're interested in working on your own sleep or you're interested in potentially becoming a sleep coach to help those around you, you can go ahead and check us out at sleepcoachacademy.org. And with that, I will end my official presentation here, and I'm happy to take any questions. I see there was a question over here. I will discuss this. Oh, a few questions. Okay, sorry. I will address the questions as they came in. Question number one. Hi, Doron. I'm sending in the questions in case you can't hear. Yeah, I can't hear for some reason, but that would be great. Okay, question number one. My husband is 76. Since his youth, he's been a night person and gets so much more energy as it gets dark. He doesn't feel tired into the wee hours of the morning. Are the rhythms out of whack, or is it normal for others? Yeah, look, I think it's while that's not super common, it is the reality, and I think that he has to embrace that. Now, again, I think there's within reason. At what point does it get problematic? If it works for him and it works for his schedule, and he goes to bed super late and he wakes up late and he feels great, and that's his chronotype, then I wouldn't run to try to fix it. If there are problems, if he's just not getting the right amount of sleep, if he's feeling exhausted, or if it just doesn't fit into his lifestyle, there are ways to, kind of shift the sleep cycle back. But my first port and call would be just leave. If it's not broken, don't fix it. Question, could Ambien or other sleeping pills cause daytime mood swings? Yes, for sure. Just go ahead and Google the side effects of your sleeping pills. You're going to get a list about 100 items long. There's no shortage to potential side effects to sleeping pills. And yeah, I've definitely seen, almost everything can be a side effect of Ambien and other sleeping pills. So I would definitely look into that. Is it dangerous to take sleeping pills 2 nights a week, never two nights in a row? That's a general question. I can't answer that specifically. I believe it's healthier to get natural sleep, and I think everyone would agree with that, including the doctors that are prescribing sleeping pills. Is 2 nights a week catastrophic? No, it's definitely better than every night of the week. But I think it's worth thinking about, why you need the sleeping pills and would there be a way to get off of them naturally. Question, how to prevent hot flashes at age 76 that wake me up at night? For sure. Yeah, that's definitely something that a lot of our female clients deal with. And I think there's a lot of options. Number one, so think about hormone replacement therapy. Some of you would speak to your doctor, maybe the endocrinologist, your OBGYN, about if you would be a good candidate for that. If not, definitely there are supplementation that can help naturally rebalance the hormones and alleviate those symptoms. And to be able to think overall about stress reduction, healthy eating, and leading a healthy lifestyle that would allow the body to, prevent those side effects as well. Do you have a nutrition program? Yeah, that definitely is something that we work closely with clients on, customized nutrition based on that. Sometimes it's specifically weight loss related, especially if there's apnea, we're looking at weight loss. Sometimes it's just general body health related. You asked, the next question is related to that. What kind of doctor gives the MRT test? Yeah, our practice does it. I think you're probably going to find it more in like a naturopathic doctor, someone who works more in the functional medicine space. Generally, traditional doctors are not ordering these kind of tests, but certainly you can contact me and I can be able to connect you to the right person. I drink before going to sleep a concentrated chamomile tea, 1 tea bag, about less than a quarter cup of boiling water, cover about 5 minutes, and it's helped me fall asleep almost immediately. Great, yeah, chamomile, lavender, those can be great. And for people, a tea can just be relaxing in general, drinking a tea. And so if that works for you, then fantastic. Herbal teas are linked with all sorts of positive health benefits. And so I would definitely, if you have an herbal tea versus a sleeping pill, go for the tea. I think it'll be a great effect for you. Okay, we see another question here. I usually go to sleep around 9 p.m., sleep fairly well throughout the night with my CPAP, but keep waking up at 3 or 4 and can't turn my brain back off, so I'm up for the day. Any suggestions? Yeah, this can be tricky. I think one question to think about is how much sleep does your body actually need at this age? If you're going to bed at 9, you're waking up at 4, that's 7 hours of sleep. Maybe that's how much your body needs. Now you'll tell me, well, I don't want to be up at 4 because by midday I'm tired. Okay, that's a reality. You might want to think about getting a nap at that time if you have the ability to do so, or you might want to think about going to bed later because maybe you used to get 8 or 9 hours of sleep and that was great for you. Maybe as you're aging, your body only needs 6 or 7 hours of sleep, and if you don't want to wake up at 4, maybe going to bed at 10 or 11 would actually help bring your sleep cycle towards there. So that would be my natural intuition. If you feel like there's underlying stress or anxiety and that's why your mind is racing, it's worth exploring that as well. But if that's not the case, if just your mind's up for the day, you're not inherently anxious or stressed, just your mind is on normal, thinking production, then I think it's worth thinking about your circadian rhythm and what you want and what you find ideal. Next question, are the teas okay to take on Coumadin? You would have to speak to your doctor specifically, find out which teas. I find that generally herbal teas are fairly benign. Every individual should just try it. You could have a reaction to anything, but I really have not seen any negative reaction with any of the teas. Next question. My husband snores, but I don't think he has sleep apnea. When he changes and gets better, but it's so loud, he shakes the walls. Do you have recommendations? Yeah, for sure. Number one, I would at least get screened for sleep apnea, because if your husband is older and he snores like that, chances are that he's at least in the high risk category for apnea. I would have him get checked out. And recommendations, yeah. So our natural protocol does the whole picture, both in terms of snoring and apnea, breathing restructuring, posture, opening up the airways, nose, looking at what type what he's eating and drinking, and to be able to work closely with all the systems in his body to be able to help with that and to monitor progress as it's going along. I do believe that there is a lot that can be helped in terms of the snoring. I've taken people from triple-digit snoring scores down to single-digit snoring scores, and I do think it is important to look into what the natural holistic options can be. Any other questions? Okay. What's your recommendation regarding use of caffeine vis-a-vis sleep? Yeah, so I think the conventional wisdom is that it takes 10 hours to metabolize caffeine out of your system. So if if your last coffee is at noon and you're going to sleep at 10, that's totally fine. If your last coffee is at 4 o'clock in the afternoon and you're going to sleep at 10, you still have some caffeine in your system, and that can affect the quality of your sleep, and therefore generally recommended stopping drinking caffeine about 10 hours before sleep. But I also believe that's an individual decision. Some people are super sensitive to caffeine, some people are not sensitive at all, and they can go to have a coffee at 10 o'clock at night and go to sleep fine. So I think trust your body and trust your reaction. Next question, what do you think about supplements like L-theanine, GABA, and tryptophan? Yeah, so I think that they can be good. The question is why. If you're taking them for just general health, they can have positive health effects, and I do believe that they're better in terms of safer and more natural than prescription sleep medication. But is there an underlying issue that these supplements are really trying to mask over? Is there an underlying anxiety or stress that the supplements are trying to deal with? I always want to get to the root cause before we become dependent upon pills. Next question is, my husband jumps around in his sleep. Suggestions? Yeah, the whole sleep movement, people jumping, people, restless leg syndrome is related to this, can certainly be worked on, both from a physical health standpoint to understand, is he lacking minerals? Could there be supplementation that could be helpful? We work with restless leg syndrome as well as the subconscious mind, meaning is there a mind-body connection, like we see with TMJ, when people are grinding their teeth or they're holding on to stress in their jaw at night. I believe that's a lot of the mind and body actually, feeding into each other. And so when someone's, has the night movements, we're actually using hypnosis to help rebalance the body to get to the mind as well. Do you work with clients, patients in Israel? Yes, we work remotely. So if you're from Israel, feel free. Thank you very much. That's great to see clients in Israel. How much melatonin is safe to take? I can't answer that question specifically, but I know that our protocol is the less is better. Many times, especially Americans, like they want to supersize things. They want to, if I can't sleep, I'm going to take 30 milligrams of melatonin. That's generally not a good idea. whenever you're taking supplements, start with a lower dose. That might even be 0.5 milligram to 1 milligram, and then slowly, raise up if you're looking for more of an effect. 3 milligrams, 5, 10, above 10, I really haven't seen any benefit or any links to any benefit. But I think, to try to find the right dosage that's good for you, and speak to your doctor. Thank you. Do bladder medications affect sleep? I have a degree of incontinence. I'm not on meds now, but I'm going to inquire about their use. Yeah, look, I think that many medications, just ask your doctor what is the full list of side effects for this medication, and see what happens in your case. But yes, it's not uncommon that bladder medication could affect sleep, as well as many medications, including psychiatric medications, sometimes can have a rebound effect. I know I've had many clients that have gone on sleeping pills and actually makes their sleep worse. So I've seen it all. I've seen very interesting people's reactions to drugs and supplements, but ultimately you have to find out what works well for you. Any other questions? Looks like we're just wrapping things up. We've covered our the last 5 minutes. Okay, yeah. So I believe that sleep is something that is a very important investment. It's an investment of time. It's not a waste of time at all. It is, like I said, something that really gives us a perspective on life, and something that's so important at every age. And also to encourage maybe your kids and grandkids, wherever your family is holding, to also think about their sleep. I don't believe that there's one family in America or the world that someone is not struggling in the sleep issue, and to recognize that there are options. There's a lot that can be done. Never give up hope. Don't think that you have to just walk around chronically tired or exhausted, but to be able to explore that, to value sleep, to share with others, about their sleep, and to be able to be a sleep advocate anywhere you go. That's what I would say, and to making sure that you're getting the rest you need to be grounded, to be healthy, and to be safe for your entire life. Okay, just another couple of questions came in. Is it true that most healing happens 11 p.m. to 1 a.m.? Yes and no. I mean, scientifically speaking, it's viewed that the first REM cycle is like a double cycle. So, whenever your first cycle is, let's say either from 10 to 12 or 11 to 1, that's considered like your most important REM cycle. Your body does a lot of the work then, and later in the night, they're, so to say, less powerful than the first cycle. But I think that it's somewhat relative. Your body is healing throughout the day and the night. It's doing a huge amount at night. We're repairing the blood marrow. Our immune system is mapping out, clearing out, toxins from our brain, liver detoxification. So much of the things is going on at night. So I think that all else being equal, it's important to capitalize on that first REM cycle. Try not to push that off, but everyone is somewhat individual. Is it necessary to go to sleep at midnight, or it can just be at 2 a.m.? I think there's a general answer question, and there's your answer to the question. Textbook says go to bed earlier. Go to bed, your ideal time is between 10 and 11 for most people. That being said, if that's just not you, it doesn't fit into your personality or your lifestyle, and you're fine and you feel full energy throughout the day and you feel healthy, at 2 a.m. is your bedtime, then embrace that. I wouldn't try to put a round peg into a square hole. I think you have to decide what works well for your body. I've been told that good sleep directly affects weight loss. If I have trouble sleeping at night and can't get it under control, I forever struggle with weight loss. Yeah, this is definitely something that's a very significant issue, and you're 100% right. Good sleep affects our metabolism, affects our eating cycles, it affects weight loss. And I believe, when you say you can't get it under control, I want to know what you've tried already, because our practice specializes in cases that are a little bit, more complex, a little bit, resistant to more traditional methods. And I'd like to speak to you about what that would look like. And I would say, to put it in the positive, when you get your sleep under control and you master your sleep, you're going to see your metabolism and your weight go back to a healthy weight, and to be able to feel healthier and to burn the calories and to crave less sugar, to eat at a healthier time. So I really would encourage you to reach out to be able to help to get that sleep under control, so we can get your body to an ideal size as well. Okay, any last questions? Okay, my pleasure. Thank you so much. I appreciate it. Like I said, anyone feel free to reach out. I'm happy to help in any way that I can. Thank you for joining me, and thank you for being here today. I think it's phenomenal that each participant really wants to improve and grow in life at every stage of the game. And I encourage you to do so. I encourage you to continue to learn, to grow, to be open-minded, to invest in yourself and those around you. And it was a real honor and pleasure to be here. I look forward to being in touch. There's a question, what does an endocrinologist do? Officially, an endocrinologist is a hormone specialist. So there's someone that deals with if you have hormone imbalances, someone who can help you with that. And it's certainly worth speaking to. Is it possible a woman of 71 has a hormone imbalance? Yeah, for sure, 100%. Yeah, we have, I mean, first of all, hormones are not just about sex hormones. Melatonin and cortisol are hormones too. And our sex hormones play a factor. It's not like when we go through menopause, all of a sudden our sex hormones go down to zero. They're less than they were when you were younger. But definitely they can affect youth throughout your entire life. So certainly what to look into and to think about age appropriate hormone imbalance, what that would look like for you. Any last questions? Okay. I'm going to hop off here, but thank you so much. And I wish everyone a great day, a great evening, a great rest of your conference. And I look forward to being in touch. Thank you again to Jewish Workshops for hosting this wonderful event.
Thank you so much. I'm sorry that Doron couldn't hear us, but he was such a wonderful addition to our day. And thank you for all of those wonderful questions. Please keep them coming throughout the rest of the classes.